I have no conflicts of interest to declare. Well, thank you for inviting me. I'm a psychologist and a patient advocate since 2017 when I was diagnosed with lung cancer. I'm engaged as a board member in the Swedish Lung Cancer Association and in the vision-driven innovation milieu, Zero Vision Cancer in Sweden. I'm here to talk to you today about the importance of psycho-oncology. As for the background in this picture, I chose to show you my place to refuel. It's shot at an island outside Sweden called Fårö. And if you're at all interested in film, you might have seen it in some of Ingmar Bergman's movies, many which were filmed here, and Fårö was also his beloved home. But I'm not the only one who needs a sacred place for my recuperation. Every patient needs a tight recovery plan, including all aspects of their life, and this is what psycho-oncology is about. As for a definition of psycho-oncology, psycho-oncology addresses the psychosocial and behavioral aspects of cancer that may influence the course of the disease. It's a research field that, according to the literature, has exploded in the last 2 or 3 decades. However, I find there is still a lot to do. This is a quote from Susan Sontag's essay, Illness as a Metaphor, which is still a very interesting text about the stigma of certain illnesses. Historically, cancer has been one of those. In ancient Greece, illness was seen upon as something deserved, and disease as a punishment persevered a long time. In the following centuries, it was considered more to expose and express the character of the affected. As late as in the 60s, doctors and family members sometimes lied to the patients about what they had. Even if today's practitioners have long abandoned this route, a symbolic language still exists when it comes to cancer. You're in a fight or at war with cancer, a war which many of us in the end loses, and this is a notion that is rarely used regarding any other disease. A cancer diagnosis will make people around the patient come up with a lot of suggestions of how to change one's lifestyle or habits or outlook on life. All out of goodwill. However, this can cause guilt among the patients as if they are themselves to blame for this unfortunate event in their lives. Getting a cancer diagnosis activates some common notions associated with cancer, irrespective of probability. Death is suddenly present. Your life is threatened. You can be very determined, or you can get devastated when diagnosed. But crisis takes all forms and can develop in later stages as well. Cancer will call for an adaptation in life because of tough treatments that will take a toll on you, existential thoughts that make you consider your life choices, or because of environmental change in work, economical and personal status. Possible targets for psycho-oncological interventions are, for example, the physical symptoms that appear, like pain and fatigue. Also, the emotional distress. In some patients, a depression evolves, but in most, the fear of progression is the main issue. You might need assistance to solve practical problems. You might lose income, need help with children's care, support for your partner, or help to plan how to get back to work in a safe way. Patients are usually automatically considered having good compliance with treatment, but it should be of concern to the physician to understand the difficulties that can arise in treatment and side effects that could affect adherence or that causes discomfort should be addressed on a regular basis. Patients usually need some kind of physical rehabilitation, and it would be of great benefit if this could start when at the hospital. here's a perfect moment to examine lifestyle and improve habits, to deal with spiritual concerns and personal beliefs. All this would add to better general health. So what do patients want? It's important to remember that not every patient want, need, or profit from psycho-oncological interventions. However, patients have expressed a need for repeated evaluation of their quality of life from their doctors to be able to cover specific areas of importance in their life. When diagnosed, you typically get information of what is ahead and questions about what you want. However, many patients are not aware of their needs at this stage. Survival is the main focus. Many patients don't express their wants, and it might be difficult for the healthcare professional to get a grip of their needs. Therefore, a repeated psycho-oncological screening should take place in all stages of the disease. Patients are commonly very open for rehabilitating interventions at diagnosis. They want to be involved in their recovery. It's very important to include physical activity and to offer psychological support. In fact, the whole family should be involved in an early stage. The workplace is also an important part of the recovery plan, and there should be a collaboration with the workplace to make a plan to facilitate getting back to work and how to manage stressors that can appear. In a study by Sent and colleagues, physicians in cancer care expressed their feelings toward psycho-oncology. And they report that they value psycho-oncology in the hospital, that they believe it's effective, and that they feel a commitment to offer psycho-oncological interventions. But they also express a need for specific training to do it better. Physicians have also been asked what barriers they see to incorporate these interventions in the patient's health plan. And they have mentioned patients' own reluctancy to discuss or share distress with clinicians. They also see a shortage of services, and they report insufficient time with the patients to be able to discuss these matters in depth. So to summarize, patients and clinicians agree that psycho-oncology is an important part of the care of cancer patients. Furthermore, studies have shown that both patients, their next of kin, and even the healthcare professionals should benefit from psychosocial support. There is a need for extended services in the psycho-oncological field, and there is also a need for more research on the subject. Thank you very much.